You know, hospitals today are spending literally billions of dollars on artificial intelligence.
Oh, yeah. Massive investments.
Right. And these algorithms, they're designed to predict exactly when a patient is going to crash.
That's the overarching promise
Right.
being sold to all these hospital boards.
Exactly. That the AI will catch what the human eye might miss.
Create this, like, ultimate digital safety net for the patients.
Yeah. But putting on my healthcare tech analyst hat for a second, there is a massive fatal flaw in the math here.
A huge one.
A flashing red pixel on a screen has never in the history of medicine actually hung an IV bag.
Right. It's never saved a human life.
Never. And welcome to today's deep dive, by the way, because if you look at the modern healthcare landscape, there is this, overwhelming narrative that we are stepping into a tech utopia.
We've got predictive algorithms, early deterioration alerts.
These incredibly complex staffing optimization engines. It all sounds amazing on paper.
It does.
But our source material for today completely shatters that illusion. We are looking at this really brilliant framework developed by Timothy Simpson.
Right. He's a veteran with, 22 years of ICU experience?
Yeah, 22 years. And he has diagnosed this massive last-mile problem in healthcare tech.
It's the ultimate bottleneck, honestly.
Right, because despite all the massive processing power, predictive analytics are failing at the bedside.
Well, because you can have the most sophisticated predictive model in the world, right, pumping out incredibly accurate data.
Mm-hmm.
But if there is no physical human available to immediately execute on that data,
The prediction is basically useless.
completely useless. And Simpson proposes that the only viable solution is a highly specific human layer called the stat nurse.
The stat nurse.
Right. Without this specific role, you simply cannot transform passive AI signals into what he calls activated intelligence.
Okay, so let's unpack this. Because to really understand the solution, we first have to dissect exactly why current healthcare AI is failing in that last mile.
Yeah, let's look at the reality on the floor.
Because if I'm a tech company, I just assume giving you the data solves the problem, right?
That's the classic Silicon Valley assumption.
Right. But I imagine on a really chaotic ICU floor, an algorithm buzzing your phone with another alert while you're, I don't know, holding a patient's airway open.
It doesn't help at all.
Yeah.
It probably just pisses you off and distracts you.
Exactly.
And that paints the picture perfectly. It highlights where the tech world fundamentally misunderstands the clinical environment. Because AI in healthcare right now, it only informs.
It doesn't act.
It does not act. And in a hospital, informing without a dedicated operator to take action just creates a cascade of new problems.
Like what happens when you just dump data onto an already overwhelmed workforce?
You get massive alert fatigue. You get delayed interventions because the floor nurses are completely consumed with their primary patient load.
Wait, let's clarify something for those outside the medical field. When we talk about these alerts, we are often talking about things like sepsis, right?
Yes, exactly. Sepsis alerts are a huge one.
And sepsis is this massive, life-threatening blood infection where your organs start shutting down.
It's incredibly aggressive.
And every single minute you wait to get antibiotics into the patient's veins directly increases their chance of dying.
It is an absolute race against the clock.
Yeah.
And this brings up, honestly, the most dangerous side effect of passive AI.
Which is?
You create a false sense of system intelligence.
Oh, wow.
Right? Because administrators might look at a hospital-wide dashboard and think, oh, the system is working perfectly because the AI caught the sepsis risk early.
But down on the floor.
The patient is still crashing. The system flagged the infection, but no one had the physical bandwidth to actually prepare and administer those IV antibiotics within that critical time window.
I mean, it is like buying $1 million Ferrari to commute from your kitchen to your living room.
That's exactly it.
It's incredibly advanced, state-of-the-art, and totally useless for the actual environment it's in.
Right.
Or, to use another analogy, hospital AI right now is essentially a highly advanced smoke detector.
Ooh, I like that one.
It has lasers, it analyzes the chemical composition of the air, but when there is a fire, all it does is send a really detailed email to people who are already fighting 3 other fires.
That is a phenomenal way to visualize it. And that is exactly where Simpson's concept of the stat nurse comes in to close the loop.
Because they're the ones who fight the fire.
Exactly. This isn't just an extra pair of hands on the floor. This is a dedicated, highly experienced clinical operator whose entire purpose is to intercept that AI signal and become the firefighter.
So they execute a very specific operational loop, right? Let's walk through that loop because the mechanics here are what actually change the outcome.
Sure. So first, they interpret the signal from the AI.
Okay, reading the alert.
Right. Second, they validate it clinically, meaning they physically walk into the room and look at the patient.
Because the AI can't do that.
Exactly. Third, they prioritize the response based on real-time context that the AI simply cannot see.
Right, the messy human stuff.
Yep. Then fourth, they act. That means immediate, hands-on bedside intervention,
Pushing the meds.
pushing the meds, hanging the fluids. And finally, fifth, they document everything to ensure the hospital actually gets reimbursed for the care provided.
Wow, okay, so they really are the ones who kicked down the door with the hose.
They are.
So moving from the smoke detector just beeping to the firefighter actively spraying water, that is the jump from passive intelligence to activated intelligence.
That's the core of Simpson's framework.
But digging into the mechanics of that raises a pretty glaring question for me.
Okay, what's that?
If AI just requires a human to execute the physical task, why do we need this highly specialized, dedicated stat nurse? I mean, why can't any nurse on the floor just respond to the alert?
Well, to answer that, we have to look at the messy, chaotic reality of the hospital floor.
Okay.
An algorithm cannot walk into a room and recognize a subtle physical decline in a human being. An AI can tell you that a patient's heart rate is trending up and their blood pressure is trending down. But an AI cannot look at the pallor of a patient's skin.
Oh, right.
It can't notice that their breathing is just, slightly more labored than it was an hour ago.
Or read the room.
Yes.
There is a really fascinating detail from the source material that stuck with me on this. Simpson points out that AI cannot sense hesitation in a new nurse.
What's fascinating here is how that single detail totally exposes the hard limit of algorithms.
Yeah.
Because a massive part of patient safety is recognizing when the human staff themselves are unsure.
Right. It's not just the patient's vitals.
Exactly. So a stat nurse walks onto a unit, sees a flashing AI alert, but also sees a first-year nurse looking absolutely terrified while trying to draw up a complex medication.
And the algorithm cannot navigate that ambiguity.
They have no idea.
It also can't navigate the logistics of the hospital, right? Like when the pharmacy is delayed sending up the medication, or the lab needs a new blood draw because the first one hemolyzed.
And the patient is actively coding while all this is happening.
Right. The AI just says, give meds. It doesn't know how to hustle a pharmacy on the phone.
And that is the crucial distinction. The stat nurse provides what Simpson calls ICU-level cognition across the entire hospital.
ICU-level cognition.
Right. This isn't artificial intelligence. It is clinical intelligence. It's the ability to take immediate action under severe uncertainty.
Which machines hate.
Algorithms are fundamentally incapable of making judgment calls in ambiguity. They require clean data, and hospitals are the absolute opposite of clean data.
So because the stat nurse possesses this unique clinical intelligence, they aren't tied to a specific block of 4 or 5 patients, like a regular floor nurse, right?
Where they don't have a primary patient assignment.
They're kind of floating. And according to the source, their role naturally expands into acting as a human command center.
Yep.
Which honestly sounds mathematically impossible to me. Healthcare operations are famously fragmented. How does one person actually do that? Are they sprinting between floors with an iPad, or are they stationed at a central hub looking at a hospital-wide matrix?
It's actually a hybrid of both.
Oh, really?
Yeah, they are physically mobile, walking the floors. But they are armed with mobile command center technology, usually a dedicated tablet or phone that feeds them the hospital's central AI dashboard.
Okay.
And because of this mobility and this access, they're the only role operating across 4 distinct layers simultaneously.
Okay, let's break down these 4 layers, because this is where the operational magic actually happens.
Absolutely. So the first layer is the bedside.
Okay.
This is the immediate physical reality, pushing the medications, managing a specific patient's deterioration.
The micro level.
Right. Then the second layer is the unit layer. So while they're at the bedside, the stat nurse is also looking at the whole floor.
Checking the vibe of the unit.
Exactly. Balancing the workload, physically supporting the other nurses who might be drowning in tasks.
Wow. Then we zoom out to the third layer, which is the hospital.
Correct. Because they are moving across different units, the stat nurse manages capacity and throughput.
Meaning they know where the beds are.
Yes. They know which beds are opening up, which patients are stable enough to be moved, and where the logistical bottlenecks are happening.
Okay.
And finally, the fourth layer is the system.
The big picture.
Right. They're aligning the immediate clinical care with the AI signals, the hospital's quality metrics, and the revenue cycle.
Okay, here's where it gets really interesting for me.
Yeah.
Imagine an air traffic controller who sees two planes getting too close on the radar.
Okay, I like this.
Usually, all they can do is talk into a radio and just, hope the pilots react in time.
Right.
But the stat nurse is an air traffic controller who can instantly teleport into the cockpit.
Grab the yoke.
Yes. Grab the yoke, help the overwhelmed pilot avoid the crash, and then teleport back to the tower. They don't just see the data, they physically intervene.
And hospitals have historically lacked a role that simultaneously sees the patient, the unit, the hospital, and the system all at once.
It's all siloed normally.
Exactly.
Yeah.
The stat nurse unifies fragmented healthcare operations in real time. They see the AI alert from the system. They know the unit is understaffed. They know the patient at the bedside is crashing.
And they know the hospital needs that bed turned over for an emergency room admit.
Right. And they process and act on all of that at once.
That air traffic controller perspective is fascinating. But let's bring it back down to the ground for a second.
Okay.
If this stat nurse is seeing the whole board, how does that actually change the day-to-day survival of a brand new, terrified 22-year-old nurse on the floor?
It changes everything.
Because operating at that unit level directly addresses one of the absolute most critical vulnerabilities in modern healthcare, right? The nurse retention crisis.
I mean, the retention crisis is arguably the biggest threat to hospital viability right now.
We hear constantly about nurses burning out and leaving the profession in droves.
Yeah.
And there is this common misconception that they're leaving because the physical work is too hard or they just can't handle the medical tasks.
Right.
But the source explicitly states that healthcare is losing nurses not because of incompetence. So why are they actually leaving?
They are leaving because of the psychological toll.
The mental weight of it.
Exactly. The source pinpoints 3 critical drivers of burnout. It's isolation, overwhelm, and a lack of support during life or death moments.
Wow.
I mean, imagine being that 22-year-old nurse. You've been on the job for 6 months.
Barely off orientation.
Right. You have 6 patients. Suddenly, your phone buzzes with an AI alert that the patient in room 4 is deteriorating.
Okay.
You walk in, the alarms are blaring, the patient is unresponsive. You know you need to act, but you are completely isolated.
You are overwhelmed by the cognitive load of like a dozen competing priorities.
Yeah.
And if you make a mistake, someone could literally die. That is an incredibly heavy burden to carry alone. It's no wonder people are leaving the profession.
It is an entirely unsustainable environment. But the presence of a stat nurse changes that dynamic instantly.
How so?
They arrive at the bedside, not as a manager there to grade the floor nurse,
Right.
but as immediate backup. They provide what Simpson specifically calls non-judgmental ICU-level support.
That phrase right there, non-judgmental, that feels like the secret sauce here.
It completely alters the psychological safety of the unit. The stat nurse builds confidence in real time. They step into the room and they just reduce the cognitive overload. They say,
Right.
I've got the IV and the blood draw, you call the attending physician, or let's walk through this sepsis protocol together step by step.
So it's real-time mentoring.
Exactly. And this real-time mentoring leads to incredibly fast competency growth. But more than that, it keeps nurses from quitting because they no longer feel abandoned in the most terrifying moments of their careers.
They feel like someone actually has their back. And that makes total sense clinically and psychologically. But, and I am going to shift back to my tech and finance analyst persona for a second.
Uh-oh, here we go.
I have to tackle the massive elephant in the room. From a spreadsheet perspective, adding another highly specialized senior-level clinical role sounds like a massive new cost center for a hospital.
Right.
I mean, you were talking about paying top dollar for an ICU veteran who isn't even carrying a primary patient load. How does a hospital justify that expense?
Well, hospital administrators usually look at it exactly that way, as a pure labor expense.
It's hard not to.
But the source data prove that is entirely the wrong framework. If we connect this to the bigger picture, the stat nurse is not a cost center.
Okay.
It is a real-time revenue protection system embedded directly into clinical care.
Okay, walk me through the mechanics of that, because how does paying a senior nurse's salary actually protect revenue?
Let's look at the prevention of high-cost events. When a patient deteriorates unexpectedly, what the industry calls a failure to rescue, or when they have to be unexpectedly escalated to the intensive care unit, the financial impact is staggering.
How staggering.
The source data shows that preventing a single failure to rescue or ICU escalation saves the hospital between $10,000 to over $50,000 per case.
Wow. So just to be clear on where that massive number comes from, an ICU bed means ventilators, one-to-one nursing ratios,
Incredibly expensive continuous medications.
and a drastically extended length of stay, right?
All of the above.
Yeah.
The overhead of an ICU bed is astronomical compared to a regular floor bed. So if a stat nurse intercepts an AI alert and stabilizes just one patient a week who otherwise would have crashed and ended up on a ventilator.
They are paying for their own salary in a matter of weeks.
Exactly.
$50,000 for one avoided ICU stay. That math is pretty undeniable.
And we haven't even touched on CMS penalties.
Oh, right.
The stat nurse helps avoid mortality flags and readmissions, which directly impact Medicare reimbursements.
Wait, for those outside the hospital billing department, CMS is the Centers for Medicare and Medicaid Services, right?
Oh, yes.
So if a hospital messes up, or has too many patients dying from sepsis, the government literally cuts their funding across the board.
Yes, they do. A poor safety record can cost a health system millions in withheld Medicare payments.
Wow.
And the stat nurse actively prevents the events that trigger those penalties. But, it's not just about stopping bad things from happening. It is also about throughput acceleration.
What does that mean in this context?
The stat nurse identifies discharge barriers early. They align care progression so patients leave exactly when they are healthy enough to leave.
Okay.
This directly reduces ED boarding, which is when sick patients are stuck in the emergency department hallways because there are no clean beds upstairs.
Ah. So by turning beds over faster, the hospital can actually increase its daily case volume and admit more patients without having to physically pour concrete and expand the building.
Exactly. They are maximizing the real estate they already have. The efficiency gains are massive.
Unbelievable.
And the final piece of the financial puzzle is documentation and charge capture integrity.
Charting.
Yes. The stat nurse ensures that things like sepsis timing compliance are documented perfectly in the electronic health record. They ensure that critical interventions and rapid responses are actually captured.
Because if it isn't documented properly, from an insurance and billing perspective, it never happened.
The hospital simply won't get paid for the work they did. So the stat nurse prevents the hospital from losing revenue they have already rightfully earned.
They align the messy clinical care with the strict billable reality.
Right. When you combine the $50,000 savings on ICU preventions, the increased throughput, the protected billing, and the reduction in nurse turnover costs, the return on investment isn't just positive, it is exponential.
So what does this all mean for the AI systems we started talking about? Because it sounds like the million-dollar investment that the hospital made in predictive software only actually pays for itself if the stat nurse is there to catch the alert.
To catch it, stabilize the patient, and document the intervention.
Right. Without the stat nurse, the hospital basically bought a Ferrari, left it in the living room, the building burned down anyway, and the insurance company refused to pay out because no one documented the fire correctly.
That perfectly summarizes the current broken state of affairs in many health systems today. They are buying the software, but completely ignoring the human infrastructure required to run it.
Synthesizing everything we've unpacked today, it feels like hospitals are running out of time to figure this out.
They really are. The source points out that the next 3 to 5 years are going to be an absolute pressure cooker.
Yeah, we are looking at narrower financial margins, increased scrutiny from organizations like CMS,
Massive ongoing staffing instability.
and this tidal wave of new AI systems being heavily marketed to hospital boards.
The operational pressure is compounding daily. And this is exactly why Simpson's future state model is so vital for survival.
Walk us through that model.
It outlines a very simple chain of events, but it is the only alignment that mathematically works. It goes like this. AI layer, leading to the stat nurse, leading to action, leading to an outcome, leading to revenue capture.
Let me repeat that sequence just so it sinks in. AI layer, stat nurse, action, outcome, revenue capture.
Perfect. If you remove the stat nurse from that chain, the AI just becomes white noise.
The alerts just get ignored.
Right. The value of the technology investment drops to zero, and patient outcomes simply plateau or worsen. But with a stat nurse, that predictive AI becomes actionable.
The chaotic systems become efficient.
And outcomes improve measurably.
It is the human layer that makes the artificial intelligence actually intelligent.
Exactly. Hospitals that implement the stat nurse at scale are going to dominate financial efficiency. They will lead the industry in workforce stability, and they will actually maximize their AI investments.
So they won't just adapt to the future of healthcare, they will dictate it.
Spot on.
Well, thank you for joining us on this deep dive. We've covered a lot of ground today, from the limitations of algorithms to the absolute necessity of clinical operators navigating the messy reality of a hospital floor.
It's a critical conversation to be having right now.
It really is. But I want to leave you with a final thought to mull over, one that pushes slightly beyond our source material today.
Oh, wait.
Because if Timothy Simpson is right, and an advanced AI system is fundamentally useless without a highly trained stat operator to intercept the data and execute the physical action, what does that mean for the rest of the world?
That's a great question.
It makes you wonder. If hospitals eventually perfect this human AI, Luke, will other high-stakes industries like aviation, nuclear power, or even autonomous logistics start adopting their own versions of the stat nurse to basically babysit their algorithms?
No.
Are we entering an era where the most valuable job in the economy isn't programming the computer, but simply being the ultimate human failsafe for it? Something to think about next time you see a flashing red alert.